one trend that has been persistent that we're aware of, given the data that we've had historically, and it shows in our current data as well, is that African, Caribbean, and Black people have remained overrepresented in new HIV infections in Canada overall, and in Ontario specifically, where the AC study was conducted. So in Canada, African, Caribbean, and Black people account for about 2.5% of the population, but account for about 25% of new HIV diagnoses in Canada in 2019, and that's the latest year of data that we have. And in the Ontario context, African, Caribbean, and Black people account for about 5% of the population of Ontario, but we are again 1/4 of new HIV diagnoses in Ontario based on data from 2019. Those statistics have been quite stubborn. So we've had ranges from 20% to even as high as 29% of new diagnoses being in African, Caribbean, and Black people. But what we do know is from our study, and we hope to be able to repeat this study in the future using the same methods so that we can have these trends. But we found that the overall prevalence of HIV in the AC study was found to be 7.5%. Much higher than the Canadian prevalence, which is less than 2%.
With regards to the trends, we noted that it is higher in males than in females. It's higher in people whose sexual orientation is not heterosexual. It's also higher in people who are unemployed and people with a lower level of education. And it's also higher in Black people who were not born in Canada.
It has to do with the social determinants of health. We know that health is not just health by itself. If you don't have housing, if you don't have a proper meal, 3 meals a day, if you don't have health care, and everything surrounding your health itself, mental health, that all leads to the incidence of the HIV going up because you're not being taken care of as a whole. So, of course, immigrants and newcomers, especially us African, Caribbean, and Black people, when we arrive here, we don't have all those generational wealth, for example. But the white population, white Canadians, they have generational wealth. They have been in the system their whole lives. They have doctors. They have accessibility to everything. A lot of the white people also, they have good jobs where their jobs have all the benefits. For example, PrEP now is used as prevention, and the Black community do not have as much access to the PrEP. But the white folks, because they've been so established, the drug is covered. I mean, now it's a bit easier because we have a PrEP clinic here at the AIDS community of Ottawa, so they make it a bit more accessible for the marginalized folks. We have to start educating our people about high-risk behavior, and we need money to be put into these programs where we can educate the public, and especially our community, that HIV is here, it's not a gay disease, anyone can contract HIV.
Talking about social determinants of health and how those are the important factors that drive population level health outcomes. And so there are many ways of categorizing those social determinants, but I like to categorize them as economic determinants, legal, social, policy, and epidemiologic. And so for economic determinants, I was talking about things like low wages and precarious work and how studies have shown that those increase HIV vulnerability. From a legal perspective, so laws around immigration and citizenship, laws around the criminalization of HIV transmission or HIV exposure, those help to create a context that helps to make African, Caribbean, and Black people even more vulnerable to HIV. Social factors like discrimination, so anti-Black racism and stigma, each of those acting individually and then acting together to shape these unique experiences that we face as Black communities and communities that are disproportionately affected by HIV. Policies around the availability of health resources and social resources, where those are distributed, when they're available to people, so when there can be accessed, right? The allocation of research funding even, so what topics get studied, what populations get studied, what populations become part of an overarching research strategy for Canada, what is deemed to be impactful enough for the Canadian population. So when you consider that African, Caribbean, and Black people are 2.5% of the Canadian population. And so if research funds are being allocated based on what will have the biggest population impact for Canadians as a whole, you could see as how at 2.5% of the population, we're a drop in the bucket for an overarching strategy looking at health outcomes for Canadians overall. And so if we're not focused on African, Caribbean, and Black populations and looking at our communities specifically, we can actually miss important factors that are associated with our health and well-being. And from an epidemiologic perspective, behaviors are necessary, but insufficient. And so two people can exhibit the exact same behavior, but have a different likelihood of being exposed to HIV. And that's because, for one, the prevalence of HIV and sexually transmitted infections in people's sexual networks is an epidemiologic factor that impacts HIV transmission. So if there's a low prevalence in your network, and say you're having condom-less sex with 10 partners, right? The likelihood of you encountering HIV is much lower than someone whose sexual network has a higher prevalence. So same behavior, different risk.
ACB folks are a really diverse group of people, whether it's through language, culture, religion, ethnicity. I think it's just the way a lot of our communities are just talking about sexual health is just, it's really tricky. I know for myself, like I'm someone who's Muslim, so that religious aspect comes into it too, where having conversations on sexual activity in general is something that happens after marriage. But in the reality, a lot of folks are engaging in sex before marriage. So it's important, in my opinion, it's important to have these conversations early to kind of prevent a lot of folks from being in situations where, you know, if they contract an STI, contract HIV, if we're not having these conversations, folks don't know where to go to get services, and they're in a bit of a limbo there.
Even though we didn't even ask about stigma directly, there was an overarching theme throughout our study, especially in our qualitative findings from the focus groups. People talked about stigma being a barrier to accessing and sharing information about HIV, a barrier to getting tested for HIV, and even a barrier to HIV disclosure in ACB communities. So stigma being a barrier to HIV prevention and treatment and care. Overall. And as I mentioned, stigma is a social factor. It's at the structural level. It's outside of individuals' control. But it influences so many things. Like it influences our sexual practices. It influences our risk assessment and our decision-making around those sexual practices and how we engage with our partners. So if stigma prevents someone from disclosing their status, and we automatically assume that if HIV positive status is not disclosed, then the person must be HIV negative. You could see how stigma may influence decisions around that sexual encounter.
I would like to see more resources put towards research on Black people and curbing the HIV pandemic. I would like to see more resources put towards tailored interventions that are geared to help Black people and their uniqueness in terms of those who are immigrants, in terms of those who have a low socioeconomic status, also in terms of those who are minorities, linguistic minorities, for example, the French-speaking Black people in Ontario who may not have access to resources simply because of language barriers. I do not think we have enough representation for the lobbying, and even if we were to have enough representation, the people who are lobbying need to come to the table with something. They need to come with data, they need to come with evidence, and our job as researchers is to help to create that evidence so that they have stronger arguments when they're trying to make the case for why there should be a focus on Black people and HIV in Canada. And the next thing, which might have some value, would be to show the economic impact of having several Black people suffering from HIV and how this affects the Canadian economy and how this impacts the outlook for Canada overall.
Using that social determinants of health model, talking about sexual health as a larger part of our health and wellness, we can kind of in the way that we do our community events and workshops, add it in that way. So if someone invited me to talk about wellness, sure, I'll talk about other things, and then I'll slowly, kind of in the way we do our hair, mind, body, and soul event, be like, here are some resources and information. If you need to access Pepper Prep, or if you need to access an HIV self-testing kit, or here are a list of places in the city of Ottawa where you can get sexual health testing. And even if not just testing, because most of these places, including our own PrEP clinic, also offer vaccinations too. So I think kind of like slowly teasing it in a larger conversation of health and wellness that's also culturally specific to our community, I think is really important. And asking communities what questions do they have that we can answer. So maybe, for example, if folks want to know about like drugs and things like that, we can talk about that and then connect that to the work that we do in the HIV sector, as harm reduction and HIV are very much connected.
I would say, like, when we have an event, and we go there, we set our table to put like HIV information. Not many people will come to our table because they're perceiving that, if you go to ask information about HIV, you are already HIV positive or you are already involved in sex. Then people don't want. Then we, as an organization, we have to come up with a creative idea, approach to reach out to those people. We got some nice gift bag and put the information inside, and a little of candy, a little of that, and give away. People asking, what is that? Oh, it's a small gift, and people are taking it. That's what we do.